So thanks everyone so far that's joined on to the webinar. I'm pleased to introduce Anna Edwards, who is Anna is our innovation project manager at the Health Innovation West Midlands and a secondary care pharmacist. She leads the projects aligned with the NHS and long-term plan and net zero report, also including cross-section working with the West Midlands Pharmacy Environmental Sustainability Network. She's also developed a quality improvement project adopted nationally by the Royal College of Anaesthetists. It's a pleasure to hand over to Anna to take us through today's webinar and talk on carbon uh, on sustainability in the NHS.
Brilliant, thanks, Andy. So yeah, as Andy said, I'll just outline some of the sort of the background and the requirements in terms of navigating some of the NHS sustainability standards. So I'll be looking at firstly health innovation networks and how they may be able to, or how they work within the NHS landscape, NHS net zero, climate change, and some of those implications. The NHS net zero requirements and some of those timelines, a little bit around carbon reduction plans, science-based targets, circular production, and design for life. I will introduce sort of sustainability impact assessments and some of the things that you may need to watch out for with those. And then finally, the benefits of some of these sustainability improvements. So the Health Innovation Network is funded by the Office for Life Sciences to help innovators to spread their great ideas and technologies, and in doing so support economic growth. They act as an innovation exchange between health systems and between innovators. There are 15 health innovation networks that work in partnership with public and private organisations across the innovation landscape to deliver the common goal of improving patient care. Health Innovation West Midlands supports health and care innovators and SMEs to develop their ideas or products into commercial reality through their bespoke advice and our programs. And we also work with our local health and care partners to establish what their priorities are and work with them to identify and match solutions that will meet the health system needs. Health Innovation West Midlands covers a very broad geography. We cover 6 integrated care boards, so working all the way in the north from Staffordshire down to Hereford and Worcestershire, across in the west, Shropshire, Telford and Wrekin, and over to Coventry and Warwickshire with the Black Country and Birmingham and Solihull included as well. We seek to lead through convening, delivering evidence-based interventions to improve health and wealth, and we look to undertake delivery of new innovations at pace and scale, supporting and helping to support the workforce of the future. So as I said, we cover 6 integrated care boards. There's a number of trusts, so 24 NHS trusts, 90 hospitals, and a really large proportion of GP surgeries and primary care networks as well, alongside sort of over 1,500 care homes. So a really large and a really broad range of people that we're able to help impact better health with. So I'm going to start just out very quickly by looking at the United Nations Sustainable Development Goals. The UK is committed to supporting the global sustainability by aligning to these, and the NHS sustainability measures really do support these goals. And some of the really significant ones that we can look at in terms of sustainability is Goal 7, which is clean energy, so switching to renewables and energy efficient systems. Goal 12, which is responsible consumption, minimising waste and using sustainable materials. Goal 13, which is that real climate action, cutting emissions and adopting low carbon practices. And looking wider as well, Goal 14, life below water, so reducing plastic use and water pollution. And then actually Goal 3, good health and well-being. So looking to design for healthier outcomes, but also looking at the real prevention side of things. If we're able to prevent ill health, then we're able to have good impacts on the environment as well. And it's really a call to action to embed sustainability in design, supply chains, and in our reporting. So within the UK, on July 2022, the NHS became the first health system to embed net zero into legislation. That's through the Health and Care Act. And this meant that the Delivering a Net Zero National Health Service report is issued as statutory guidance. So this aims to cut the NHS carbon footprint for the emissions that we control directly to net zero by 2040, and for the NHS carbon footprint plus, so that's the emissions that they can influence by 2045. So if we look at that and what is within the NHS carbon footprint, so we have scope 1, 2 and a subset of scope 3 emissions. So that's looking at fossil fuels, NHS facilities, anaesthetics. So some of the anaesthetic gases are really have a really high carbon footprint, and that's already been considerably worked at with reduction of a gas called desfluranes. That's very minimally used within the UK now, and also looking at how they manage some of their nitrous oxide facilities. So a great deal of work going on there to really try and cut those emissions. And also looking at the NHS fleet and the licensed vehicles. So scope 2, which we expect to be around energy usage, and then those select scope 3 ones. So energy from the well to tank, business travel, waste, water, and also included here are metered dose inhalers, which have a very high carbon footprint. And that leaves with the carbon footprint plus, and there's quite a number of things contained within here, things like medicines, medical devices, food catering, staff commuting, and that type of thing there. This is another little nice graphic from the NHS report, and that highlights some of those carbon hotspots, which can be really helpful for just helping to target what kind of interventions can be made and where that maximal impact will be. So we've got there, we can see acute care and primary care both have quite a significant amount of carbon hotspots in terms of their energy usage, which we would expect. But then if we look further down, we can see that medicines and chemicals and medical equipment, and particularly have really high sort of use in our areas in which we can target. And you might think, actually, why is this important? Well, it's all about trying to reduce the impacts of climate change. Climate change refers to the long-term shifts in temperatures and weather patterns primarily caused by human activities. And this is especially caused by things like the burning of fossil fuels like coal, oil and gas. These activities increase the concentration of greenhouse gases such as carbon dioxide, methane, nitrous oxide in the Earth's atmosphere. It traps the heat, leading to global warming. And key aspects of climate change include some of the things right down the bottom. So we've got things like rising global temperatures, melting glaciers and polar ice, rising sea levels, more frequent and severe weather events, so hurricanes, droughts and floods, and shifts in ecosystems and wildlife patterns. And this has considerable impacts both on society, on industry, health systems, and also health of individuals as well. And we can see that really demonstrated within this picture. So we have things like housing damage, damage to infrastructure, risks to both health of people and health of staff, and then we have other impacts that will be to both individuals and health systems in terms of things like heat-related illnesses. If people have to move home, or say had a house burnt in a wildfire or something like that, there's obviously that emotional trauma and anxiety and things that follow with that, alongside loss of jobs. There are increased risks of things like respiratory disease with global warming that has been evidenced to be true. And what we see as well is a change in what we call the vector ecology. So things like infectious diseases, things like malaria and Lyme disease, their range is spreading. And we see that particularly with Lyme disease in the UK, that the area where Lyme disease and the ticks have spread has expanded due to climate change. So there's that increased risk of infection and then impact on the health service through that as well. And of course, you've got that risk as well to food stability and food sources, particularly with those changes in weather that run risks. So in 2015, there was something called the UN Paris Agreement, which aims to achieve a global balance between the human-induced emissions and the removals of greenhouse gases. And the status of that balance is referred to as achieving net zero and global greenhouse gas emissions. And what the targets there are to limit the global warming to well below 2 degrees above pre-industrial levels, and pursuing efforts to try and limit that to 1.5 degrees. So you'll often see that talked about when we're talking about climate change, those particular figures, and that's a key agreement that was made. So as I said, net zero refers to the balance between the amounts of greenhouse gases produced and the amount removed from the atmosphere, and we reach that net zero when the amount we add is no more than the amount taken away. And there are a growing number of companies that are committing to net zero, but there's not a great deal of sort of science-based methodology available for setting and approving the targets, but there are 3 key elements that need to be included and thought about. So to set and pursue that target of 1.5 degree, and there is an organisation which I'll talk about further on called the Science-Based Targets Initiative, which is looking at those science-based targets. The boundary must include or be with the global scopes of 1, 2 and 3 emissions, and the remaining hard to decarbonise emissions can be compensated either with certified greenhouse gas removals there. And there are 2 ways that we can look at carbon offsetting, so through carbon reductions, and then through carbon removal. So examples of emission reductions or offsets include reducing or capturing emissions of harmful long-lived pollutants and avoiding deforestation if we can. And some of those carbon removal offsets may be things like nature-based solutions such as the restoration of peatlands, coastal habitats, native forests, and potentially technology-based solutions as well, such as direct carbon capture. But we do have some standards, so PAS 2060, which outlines how you would achieve carbon neutrality. So the aims of within net zero and reducing carbon can be outlined with the greenhouse gas hierarchy. And this goes from sort of left to right in this instance. So we want to try and eliminate as much as we can, so prevent the emissions entirely. And that may be through redesigning products or services, changing business models, stopping high emission activities. We want to look to try and reduce. So the goal here, minimising the emissions through efficiencies. So that may be improving energy efficiency, optimising logistics, reducing waste, or using digital tools to streamline operations. And then we would like to look at substitutes, so replacing those high carbon inputs with low carbon alternatives. So are we able to switch to renewable energy, use electric vehicles, adopt low carbon materials? And then finally, is that compensate? So that's where you're looking at that offsetting of the unavoidable emissions. And I've talked about what some of those ways in which you can offset can be. So the NHS in England has committed to reaching net zero by 2045 for those emissions that are influences. And it has published the NHS Net Zero Supplier Roadmap to help suppliers align with the NHS Net Zero ambition, and it is supported by the Evergreen Sustainable Supplier Assessment. So you can see from this timeline that we're already kind of halfway through. We're working towards the 2027 targets, and this is having a carbon reduction plan in place for scope 1, 2 and 3 emissions. And then in 2028, it's working toward its individual carbon footprint requirements. And from 2030, suppliers will only be able to qualify for NHS contracts if they can demonstrate their progress through published progress reports and continued carbon emissions reporting. So something to really be aware of and having a really good read through the documentation. So In order to achieve this, the NHS is taking a multifaceted approach to trying to reach net zero. It's looking at a contract level, so looking at net zero and social value model, particularly aligning to PPN 0621. It is looking at good corporate governance, so this is where carbon reduction plans come into place, but also looking at some of those additional social value models and requirements, so looking at incorporating, trying to tackle modern slavery as well within the supply chains. And then we have that Evergreen Sustainable Supplier Assessment, which shows exemplar performance and sort of a tiered approach in terms of how you're meeting those net zero targets and maturity of your organisation. The Evergreen, it's worth of note that the Evergreen Sustainable Supplier Assessment is not compulsory, apart from with medicines procurement and with some established contracts already. So just worth making sure that you're aware of what those requirements are and where you might sit there. So carbon reduction plans within that timeline have certain requirements. They have a commitment to net zero by 2050. They need to align with PPN 0621, which is the central government procurement policy, and they need to use greenhouse gas protocol for emissions reporting. Excuse me. And there are standards as well, so particularly some of the ISO standards which align with carbon reduction plans. There is an official government carbon reduction plan template, of which if the first page, as you can see just there, and there are technical standards that need to be adhered to when completing that as well. It needs to include baseline and current emissions for scope 1 and 2 emissions and 5 of the scope 3 categories. So again, there's upstream transport and distribution, waste from operations, business travel, employee commuting, and downstream transport and distribution. The emissions need to be in CO2 equivalent for the 7 Kyoto Protocol gases, and there needs to be some environmental measures, management measures in place. There are approvals and publishing requirements for these as well. They need board or director approval sign-off, and they need to be clearly published on the website and updated annually. So there's a link there for further information in terms of and how you can link through to that. And I have supplied links to sort of the key resources to be able to help support people navigate through this. We then look at the Evergreen Sustainable Supplier Assessment. This is a self-assessment and reporting tool for suppliers to share sustainability information with the NHS, and its aim is to provide a single route for information and data sharing between suppliers and the NHS. So once the supplier has completed the assessment, they receive a sustainability maturity score against the NHS priorities, and that signposts their current position and their pathway to progress. This will help people to be able to benchmark themselves against their current and future NHS priorities. So suppliers can see how they align to the NHS long-term sustainability priorities. It does create one conversation, so you have a standardised way of communicating sustainability information to all NHS buyers, and it will help support the sustainability ambition. So as a supplier, you can use the assessment to help inform internal planning, decision making, such as developing business cases for sustainable investment or for global target setting as well. And this Evergreen Sustainable Supplier Assessment is hosted on Atomus. So there are different requirements for the different levels of maturity, and it incorporates those aspects of social value, of which net zero and the modern slavery part are really key. One of the aspects particularly that I'll talk about and sort of the next slide that we go through is, which is required for level 3 and level 4 maturity, is the requirement for validation, and this is where science-based targets come into play. As I said, science-based targets are required for the upper levels of the Evergreen Supplier Assessments. and they outline how much and how quickly a supplier will need to reduce the greenhouse gas emissions to prevent the worst effects of climate change. So they have near-term science-based targets, which is sort of 5 to 10-year timeline, and that ensures that the company is taking their near-term action to try and reduce emissions at a pace that is consistent with keeping global warming below that 1.5 degrees Celsius. And then the long-term net zero target. The timeline for that is 2050, at least by, and that just helps to provide clarity about the direction that the company will follow, and guidance for some of their long-term strategic investment decisions with that. A link just at the bottom of that is that actually NHS Sustainable Procurement team have got webinars to support this, and to support companies with this, and quite a lot of those are actually recorded and available on demand. So, and then I'll just outline a new initiative from the government within the last year or so, which is the Design for Life roadmap. And this is where it's seeking to create a circular system, which will obviously support the NHS net zero priorities. So currently in medtech, in terms of sort of circularity in medtech, means that designing, procuring and processing medical products in a way that enables them to be reused, remanufactured or recycled, trying to preserve their value for as long as possible. And the NHS clinical waste strategy, it notes that medical devices are contributing to tens of thousands of tonnes of waste produced by the UK health services each year. So many thrown away devices are single-use plastics, but others can be more sophisticated composite devices that contain rare minerals such as titanium, palladium, platinum, and so they can have a really high value. And some of those products are disposed of regardless of the fact that some of these materials are increasingly scarce. They may have economic value, and could be recovered for sale to help cut NHS costs. I think it's just really concerning that the volume of products that's thrown away. So it can be anything from tourniquets to scissors, high-tech electronics. I think that's a real concern for all of us, and that we need to take steps to try and improve this. Another concern within the Design for Life roadmap is that by the UK relying on high volume products imported from overseas, it can make patient care vulnerable, particularly to global supply shocks. And shifting to circular methods of reuse, remanufacture and recycling, we can try and keep the resources as close as possible to where they're needed. Generate opportunities for UK business and infrastructure, while doing that. And it's interesting to note that they have taken on some evidence from COVID from Belgium, and they discovered that actually a third of Belgian companies that were using circular techniques experienced significantly less disruption during the COVID pandemic. So the aims of this really are to end over-reliance in the vulnerable supply chains, end wasteful practices, embed a more circular approach to medical products, to allow for continuity of care and best value for money, and try and help create jobs and opportunities that boost the UK economy. And there is some argument that in certain areas there will be cost savings associated with this as well. So the diagram here shows this process of the circular economy that they're talking about, looking at a cycle of repair, reuse, remanufacture. And it's really working sort of from the right-hand side over. How can we get the most use out of what we've got? And there's lots of opportunities here. So in Northampton, for example, the single ophthalmology department was able to save 1,000 pairs of single uses, so £12,000 worth of costs by switching to reusable pairs that can be decontaminated along with other surgical instruments. So when we look at some of those things, if we look at, say, reduce or remove, we could look at reducing or removing from use things like surgical trays, so rationalise those, only use the required instruments. We can look to extend the use, so things like ultrasound probes can undergo regular maintenance and repair. And there's a big push for mobility aid take-back schemes to be refurbished for reuse. In terms of remanufacture, so MRI machines, example, could be re-engineered to a new condition using minimum amount of new parts. And just looking at things like recycling into new medtech, so IV bags collected after use for recycling into new medtech products. And we see as well, so we've certainly seen the recycling of insulin syringes through into both light bulbs and plastic chairs as well, to just try and help that circular economy there. So I wanted to just take a moment to think now about some of those considerations in product development. There's a number of aspects that can be thought about or incorporated both into the product development or pathway development that may help to improve the NHS Net Zero targets. And so I'll run through some of these through the next slides. But alongside this, some of these are actually potential benefits, USPs, selling points that you're able to bring alongside your products. And it's worth noting that a number of NHS organisations, they already utilise sustainability impact assessments, which include some of these aspects that I'm going to talk about over the next few slides. And that's part of their project approval process. So I think it's really critical just to think about these things as you're designing and developing projects and pathways to be able to help just strengthen the business case that you have to be able to provide goods and services to the NHS. So things we want to look at would be water, so the amount of water used, substances disposed of into foul sewer, so just thinking about that wider ecological impact of development. I know that a lot of the targets within the NHS are certainly around net zero, but it's really important to think of the wider environmental impacts of things that are being developed. We look at energy usage, so whether that's going up or down, whether we're needing heating or hot water, and whether there's any increased carbon emissions from building energy use throughout that or reduced ones. We're looking at kind of models of care. Are we able to deliver care to people closer to home, so reducing some of those journeys that people are taking? Are we able to promote prevention, so things like vaccination, just helping to reduce the need for further healthcare use in the future and disease prevention. Healthy behaviours, mental well-being, helping people to self-manage, trying to look at whether we're able to reduce hospital admissions or residential care admissions, and as mentioned, sort of streamlining those care pathways to reduce any waste or excess usage within them. We look at waste. Is it increasing or decreasing the amount of waste generated, or is it changing the waste that is being produced, because that will affect, and it may affect actually the amount of energy required to dispose of it as well. So do you need to make more separation with that? Will that have add-on knock-on effects, or is it creating hazardous waste potentially? And then again, looking at those journeys, which I have mentioned before, are we able to do things closer to home? Looking at things like telemedicine, are we able to reduce the repeat appointments that are happening? And so what I've done here is I have just tried to visualize some of these little bits for you, so you can see the carbon impacts that can be made by different aspects of particularly sort of hospital and GP care. So if you're able to prevent a car journey or prevent an inpatient admission, there are considerable carbon savings that can be made. So it's just worth taking those and working through the aspects of those pathways, because these, again, are potential sort of benefits to organisations and product development. And then thinking again about that wider ecological and wider process, you want to look at sort of procurement. Are you able to support local businesses and social organisations? Is there social value produced by employment or training, and are there any wider health impacts? So things like, are you able to reduce antimicrobial usage or antibiotic usage? Is there an impact on air pollution? And if we just think about sort of antibiotic use, with there's evidence that actually antibiotics are getting into pretty much all of the water systems, and actually predominantly from human use within the UK, and facilitating the uptake of multi-drug resistant bacteria, which again then will impact further on health systems by being harder to treat, using more expensive antimicrobials, linking to more hospital stays and that type of thing. And those additional things, so are there sustainable travel options around? Is there a chance to enhance green space or biodiversity? And then certainly looking at adaptation plans. So how are you going to be able to deal with some of those things that we mentioned early on, that were the impacts of climate change? So the hotter, drier summers, milder, wetter winters, extreme weather events, and then of course thinking about some of those vulnerable groups within our community who will be affected by climate change even more. So looking through those benefits of the sustainability initiatives, some of those we can look at into sort of three broad sections. So environmental, economic, and social, or the brands. So looking at environmental, so that reduced waste and pollution, the lower carbon footprint, conservation of resources, biodiversity protection. In terms of economic, sometimes there's cost savings that are able to be made with this, driving innovation and competitiveness. There's long-term profitability, particularly in terms of procurement possibilities with the NHS, and it can sometimes also attract investment that way. And then looking at social and brand benefits. So particularly these days, a number of people are looking for that social responsibility and sustainability improvements that brands are taking, so that enhanced brand reputation, driving customer loyalty. Employees are often seen to have more satisfaction when they're working for an organisation that acts ethically and is trying to improve the environment and the environment around us. And it also just helps with that regulatory compliance. So there are a number of resources available. I have pulled together some of the really key ones here. So the Health Innovation Network has a Net Zero Innovator Guide, which includes quite a lot of the things that I've run through here as well. There are NHS guidelines for carbon reduction plans. So that is from NHS England. And the NHS events team offer webinars. And as I said, quite a lot of those are recorded and people are able to access those. And there are a couple of organisations that are really probably key that have a lot of information around this, and that's the Institute of Environmental Management and Assessment, and the British Standards Institute have a lot of standards around sustainability that are really worth having a look into. And I have also pulled together some of the regional support that's out there available for some of small and medium enterprises and businesses within the West Midlands area. It's not an exhaustive list, but just a range of some of those support mechanisms that are out there. So Aston University has a decarbonisation net zero scheme, helping to look there. Innovate UK has a business direct net zero supplier directory, so able to connect businesses in with each other to be able to help with those net zero solutions that may be required. And the Business Energy Advice Service has some match funding grants if you meet the criteria there as well, which is really useful to know. And then there are a couple of funding opportunities that I'm aware of. Some of them are net zero. One, the NIHR is a public health research program, so particularly looking for research in this particular area, and Innovate UK, so not particularly aligned to net zero, but there is looking at sort of some of those funding opportunities that are available at the minute. And then just to highlight Sustainability West Midlands as well, has a good section of information around sustainability within the West Midlands, but also some of those funding and connection opportunities that are available locally. So that's sort of drawing to a conclusion most of those key points about NHS sustainability. I'd really appreciate it if you are able to complete the webinar series feedback form. That just helps us to understand what has been useful for you and whether it's worth continuing with some of these sessions within the future. And so mine today was on the NHS and sustainability. We do have one coming up in a few weeks' time called Comply, Sell, Grow. It's a regulatory overview for innovators, looking at the stages to compliance, understanding your product, identifying the regulator, determining compliance requirements and effective planning and execution. So it'll be a great session that will be really useful for those that want support within that area. And I will move on to questions. I know there's a few in the chat. Am I right, Andy?
Yeah. Thank you very much, Anna, for taking us through that. Much appreciated and very informative. So the first question we got from is Walter. So how can the NHS get staff and the public pumped about sustainability practices to lower emissions without messing with patient care?
So I think there's a lot going on already. Actually, there's a number of organisations within the NHS that are really, really working at this. And I think one of the things is actually that the best sustainable care is actually the best patient care. If you're keeping a patient healthy, they're going to use less resources, or as healthy as possible, they're going to use less resources of the NHS. But I think it's also about trying to build it into just business as usual, actually, thinking about how the sustainability elements align with what is just good practice, and often trying to draw it alongside some of the additional benefits. So things like cost savings, if you're able to incorporate those within it. So it's taking what they call a triple bottom line, I guess. So looking at the financial savings, the carbon savings, but also those social savings and patient impacts as well is something I think that's really key to try and do that. But I think even just awareness of the climate change, climate impacts, and how that might affect things.
Thank you. We had three questions from Walter. The second question is, what new tech or green practices in the NHS rolling out to cut its carbon emissions, and could other healthcare systems copy those moves?
Yeah, so there's a number of things that are happening. I think there's a lot of work within medicines. So looking at so certainly looking at inhalers, looking at anesthetic gases, looking at decommissioning of pipework, looking at remanufactured devices, smart building management systems. There's a real range that's going on, and I think a lot of this is being really driven by the Greener NHS team and local people who are really keen. So there's a number of groups and organisations that are working within the NHS in various areas, looking at things like the Get It Right First Time pathways. So they have some sustainable pathways within there. So looking particularly at kidney care, dermatology within that. And there's also an organisation called the Centre for Sustainable Healthcare, which helps to support so healthcare systems, and they actually run sessions across like worldwide in terms. So there's a lot of learning that's being shared across countries, and I think the NHS really seems to be trying to lead the way in terms of sustainable practice. So trying to help build case studies and repositories to be able to share that learning and best practice.
Cool, thank you. And the final question is, what's the NHS doing to hit that 2040 net zero carbon goal while keeping hospitals and supply chain running smoothly? Any cool ideas or trade-offs being discussed that you know of?
I think,
Sorry, did you get that?
yeah.
Just
I think it's sort of the ground up. It's the ground up from the bottom level, doing some of those sustainability targets of individuals and trusts working together. But it's also that top-down approach that we've got in terms of the legislation requirements, the sustainability impact assessments, having that stepwise timeline of what both the NHS and the suppliers, because they work hand in hand, need to be able to achieve to be able to undertake net zero. I know there's some interesting, um, well, a lot of work going on to decarbonise buildings,
yeah,
solar panel use, electrification of fleets and ambulances. But just looking at all, I guess all the different areas, top up, bottom down, is really where it's going. Um, and I think
okay,
that Design for Life roadmap, trying to look at that circularity principles, bringing supplies closer um, to the areas where it's being used, so that local sourcing of goods, services, and infrastructure is something that will be quite key, I think, at the minute.
thank you. I don't know if anybody else has got any other questions. If you have, you could probably raise your hand if you have. And you can unmute, but if not, drop it in the chat as well. But otherwise, I think we're good for time, and I think questions. I'll give it a second if anybody's got any burning questions. No. Cool. Well,
Good.
thank you thank you, Anna. Thank you very much for doing that today, and very insightful. Please, if you could take the time to complete the feedback form, it should literally take like 2 minutes. It's really simple. And keep an eye out for the next webinar, which Anna highlighted at the beginning or towards the end of the session here on the 23rd of July. So once again, thank you, Anna, for doing that, and thank you everybody for attending. Have a good afternoon.
And Andy, are we going to send slides around?
If they're requested, yes, we can send the slides if they're
Okay,
requested.
brilliant.
So please feel free to request if you would like a copy of the slides. Thank you.
Thank you.